Welcome to the LMD Podiatry Podcast. Trust us to get back on your feet. Here's your host, Dr. Lauren Dabakaroff.
Hello, everyone, and we are back for another episode of the LMD Podiatry Podcast. I'm your co-host, Jeremy Wolf, of course, joined by your host, Dr. Lauren Dabakaroff. Dr. Lauren, always a pleasure.
Always a pleasure, Jeremy. Love to see you.
Yes. We are getting close to the end of the year, wrapping up a wonderful, wonderful year. And today we are going to get into a topic that, if I'm being honest, I know absolutely nothing about. So I've actually prepared some good questions for a little Q&A session. I know this is a procedure that you offer at your office that you wanted to kind of get out into the community. And what it is MLS laser therapy.
Yes.
So why don't you start off by explaining what it is in the first place, right? What is MLS laser therapy and kind of how it works?
Okay. So the MLS laser, it's a laser that heals, right? So the mechanism of action, the way it works is that it's the only FDA-approved laser that has two beams that aim at the same time. And what the two beams at the same time do is that it forces your cells to generate more energy or more ATP so that the cell heals itself. So it forces your cell to heal itself by giving it more energy, and then the area heals on its own. It almost gives your body a boost to regenerate the area.
You mentioned ATP. For those of us that are...
So
what does that mean?
So each cell has mitochondria.
Okay.
Mitochondria is where the energy of the cell gets generated, and the energy of the cell is in the form of ATP.
Okay, so in essence, the laser therapy basically goes in there and stimulates those cells and creates the energy in there for healing purposes. Kind of got that right?
Exactly.
Very cool. So what makes LMS laser therapy different from, I guess, other types of treatments that are typically used for these issues in podiatry?
So first of all, it's safe. It's non-invasive. There's no needles. There's no injections. You don't feel cold or heat. You feel absolutely nothing. If anything, you just feel better after. Like you start feeling some tingling after you're done. And it takes, a couple sessions to kick in. But the main thing, it's non-invasive. There's no surgery required. You have to think, sometimes there's elderly patients that have debilitating pain and they can't have surgery. They can't get an injection. They can't take pills. This is probably the only thing out there for them that's safe and easy to use. Easy for us to use on them. And it really does make a difference, and it heals the area.
So now we have an idea of what it is and how it differs from some of the other treatments out there. What are some of the conditions, like the specific conditions or injuries in the foot and ankle specifically, that MLS laser therapy is used for?
So I use it for a variety of different things. If someone has, for example, like the number one thing I use it for right now is neuropathy. So neuropathy is an irreversible condition it comes from diabetes or from back injuries or things like that. And patients have horrible nerve pain. And neuropathy is one of the main things I use it for, because there's really no treatment for this, and patients feel better and don't have to take pills when they do this MLS laser therapy, because it actually helps regenerate the tissue in the area, regenerate the nerves, and it helps lessen the pain. The other things I use it a lot for sprains. Like if someone has an ankle sprain or a joint sprain or some type of foot sprain or leg sprain, I focus the laser on the area of the sprain, and it gets your body to heal it faster. It makes your body lay down the foundation for the ligament to heal faster. I also use it for Achilles tendonitis, plantar fasciitis, anything chronic. It's really great for neuromas. I also use it part of my post-operative protocol. Like if someone has surgery, I have them do 6 sessions right after. It helps a lot with the pain and the swelling after surgery.
It seems like a really effective process. Is this relatively new, or has this been around for a while?
No, this laser has been around for like it's been around for decades, actually. It's just, not everybody commits to buying it for their office and having it available. It used to just be like, I know when it came out like 30 years ago, it just used to be like a wand. And now it's self-standing, and you could just position it, and then the body, you mark a grid with the laser, and the laser goes by the grid to focus on the problem area of the foot or the leg. It's also used a lot in chiropractics and pain management centers, and people use it on the back and on the shoulder and things like that. It's for every area of the body.
Yeah, I mean, it seems like a no-brainer for somebody that's having some of these types of chronic issues. Anytime there's a non-invasive type procedure that could have effects like that, it's something certainly worthwhile to check out. So, what is the patient to expect during a session? I mean, it seems pretty straightforward, but what does that look like for a patient that would come in? Is it, that's the first part. I guess the second would be like, how many treatments typically before you see effect?
So it really depends. The treatment itself, depending on, the size of the area we're treating, it can range anywhere between 5 minutes and 20 minutes. Just one session is, let's put an average of 15 minutes per session. And basically they come to the office, they sit down, my assistant positions them, and then we focus the laser to the problem areas, and they get their nice little protective eyewear, and they sit and they get the treatment. That's kind of the protocol for the office, like what actually happens in real time. But as far as length of treatment, I would say that it really depends. Like if someone has chronic arthritis, right? If they have, really bad arthritis in their foot or their ankle, usually they need 12 sessions to start with in the first 6 weeks, and then maintenance. Okay. And then if someone has a sprain, for example, they need about 8 to 10 sessions, something like that, back to back, to just help the body heal the sprain. If someone has a small little injury and they don't want any pills and they don't want an injection, I do also about 6 to 8 sessions. Trying to think what else. I'm using it right now for someone with a chronic heel pain. So they're doing 10 sessions. So it really depends. The lowest amount of sessions is the 6. For someone who just had surgery, they do 6 sessions right after the surgery.
Now, is this part of the treatment plan that you're currently doing with my stepmother, Nora?
No, I'm not doing it for her, actually.
Oh, okay. It just didn't fit into her specific situation.
Yeah. So yeah, for her specific issue, it's she needed a different treatment.
Which is going rather well, I might add.
Yes.
She's very, very happy. She keeps telling me, I'm so happy I met Dr. Lauren. She's great.
Yeah, I mean, she would probably benefit from the laser as well, looking back, but I think that she needed a different treatment to help her out with her issues. So it was more suitable for her.
Are there any risks or side effects associated with this therapy, or is it 100% completely benign in all cases?
So it's completely safe for all patients, all ages. The only time it's contraindicated is if the patient has cancer or HIV. Okay. So the reason is because there aren't enough studies to see, because basically patients that have cancer or have HIV, their cells are mutated, so we don't know what the laser would do to the cells.
Got it.
When you stimulate them, essentially. So that's the only time it's not. And if you have any type of bleeding disorder, it's advised not to do it. That's the major systemic issue contraindications. I was told that it's safe to even do it for pregnant women as long as it's not by their uterus. If you do the foot or the arm or the neck, it's completely safe.
How often do you use this in conjunction with other treatment plans or other, for instance, for the case of my stepmother, she was doing something else. When you feel like maybe this could also benefit, or maybe like post-operative, is there scenarios where you'll do a surgery on someone, and for the healing process, you'll schedule a series of treatments with the laser to ultimately speed up the healing process?
Yes.
Well, you're having a party in there, huh?
You're making noise on the camera.
That's okay. All good. We roll switches here.
So your question is, how often do I use it in conjunction
with other treatment? Yeah.
Okay. So when it comes to a sprain, like if someone, I was actually in shock myself. I have someone who has an Achilles tear. So what I did for him is I combined a stem cell injection together with the laser therapy. And within 6 weeks, his gap, without surgery, his gap closed by 85%.
Wow.
So that's pretty impressive. So I do it in conjunction with stem, like if someone has a rupture or a tear. So I always, like a bad one, I always combine a stem cell, like 1 or 2 stem cells together with the laser therapy. That's something I do in conjunction with. The other thing, the laser is also, it's so versatile. I even just was reading that it's good for fungus as well. So I can combine a topical fungal medication together with the laser for the fungus. The other thing I combine it with is, very rare do I do a steroid injection with the laser, only if the situation is really bad. But yeah, that's the stem cell. Like for really bad injuries, I will combine the stem cell with the laser. And there is actually the laser company put a study out that it actually it's very synergistic together, and it really does help heal the area faster when you do them together.
Very, very interesting. Are there any specific factors that, I'm sure there are, that you're considering when it comes to making these treatment plans? Obviously, if somebody has like a serious injury, they need surgery. But for instance, like I keep going back to my stepmom because it's familiar to me. She has these chronic issues. She meets with you. So like, what factors do you take into consideration to determine whether or not she's a good candidate for the laser versus what you actually did for her?
Right. So can I use your mom as a case why I didn't use a laser? Or no, we don't want to. Okay, so
yeah, why not?
So I'll give you two scenarios. So your mom, for example, she has her ultrasound confirmed that her Achilles tendon is extremely thick and full of scar tissue.
Okay.
Right. So in her case, shockwave therapy I thought was better because we just need to break up a lot of the scar tissue. Not to say that the laser wouldn't help her. It would help a lot with the pain and the inflammation associated with it. But to really get deep into the tendon and to wake it up and heal the area and get it to like go back to a normal tendon, you need more than just the laser. And then in another situation, I have a patient, they had really bad Achilles pain also. But again, their tendon was normal. It's just that they're always inflamed. They can't get a shot. They don't want to take pills anymore. So this would be a great option for them. So it helps a lot with pain and inflammation and things like that.
Lastly, what's on the horizon? What are some future advancements, things that are upcoming in the field with laser therapy? Like, when are we going to have that laser where whatever the ailment is, you come in and you wave your magic wand and the issue is magically resolved? When is that coming? Pull out the crystal ball.
I would have to say, there's a lot of machines out in the market, and there's I keep seeing all these ads for like stem wave and sound wave, and all of them have very similar functions, but I don't think there's anything out in the market now that's going to like immediately fix it. This is not the ending scene of Click where they just kind of scan it and fix that movie. So it's like, I wish we were there. Maybe with the new AI advances, maybe it can happen. But this, I really like this laser. Let's just summarize that I love this laser because my patients are like so happy and their pain is gone. In just 2 or 3 sessions, they already feel the difference. Oh, the other thing is
fantastic.
You have to do 3 in a row, like 3 in the first week, because the laser does have a cumulative effect. Like just like an antibiotic has a loading dose, like you take a Z-Pack, you take 2 on the first day, then 1, 1, 1, 1. It's the same thing with the laser. You have to do the first 3 sessions within the first week. That way you're kind of jolting your cells into waking up and starting the healing process. So it's just, I'm researching it myself because we've only had it for the past month or 2, and I'm seeing amazing things with my patients, and everybody's super, super happy. Even the older patients, they can't take anything, and they're doing the lasers and they're walking and they're happy and they don't have pain, and they're taking less of their pills for pain medications. So it's a great choice in those situations. And for people with, younger generation with a regular foot and ankle pain, it's just good to know. And I feel calm to know that there is something out there that is not surgery, and it's not injections, and it's not, plethora of other things that, everybody else does. It's just different, and I keep saying, I know. It works.
So yeah, it's good to know. I'm glad we did this. I had no idea about any of this. It's good to know there are treatment plans like this available. And I asked, like, tongue in cheek, when are we gonna have the magic laser that fixes everything? But that's not how this stuff works, right? There's no magic pill. There's no magic bullet. There's no one thing. It all goes back to, we said this before, taking care of yourself, right? Getting routine checkups, eating right, exercising, stretching, all the things that are difficult for people to do because it's hard, but just implementing those daily habits from a younger age, or from wherever you're at in life, really, just starting to do those things slowly but surely will generally eliminate a lot of the problems that you're ultimately solving at the office. So you hear that, everyone out there? Yeah. Stay healthy, put a routine in place, always get annual checkups. If you ever have a problem, you're experiencing any pain in the feet, anything, reach out to Dr. Lauren. She's obviously a wonderful resource. She's an integral part of our great community here, doing really great work. So if you have any questions anytime, there's always a link in the description to her contact information so you could reach her. Thanks for tuning in, and we'll catch everyone next time. I just said too. You're infected me with
It's infectious,
All right, it was always a pleasure. Good seeing you, and we will catch everyone next time on the next episode of the LMD Podiatry Podcast. Everyone, take care, have a wonderful day, and stay blessed. Bye.
Bye.
Thank you for listening to the LMD Podiatry Podcast. For more information, visit lmdpodiatry.com. That's lmdpodiatry.com. Or call 954-680-7133.